Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this evening we're discussing case number 00262, symptoms of chronic UTIs, and the translation into where the symptoms are coming from. There wasn't a chronic phase, which would be weakness, but there was an acute phase, which was the lung. So how does that translate to UTIs? Well, if you come down to this co-cycle here, we see heart, stomach, lung, kidney, liver. The lung supports the kidney. And with the stressed lung, we have lacking support to the kidney. The kidney's relationship, obviously, is to the kidney and urinary bladder. So the kidney is not stressed or weak from that, but we see that being translated to the urinary bladder would lead to infection. So that lack of support here is going to be translated into the UTI. And so what does that mean in terms of mechanical function? If we look at this model here, apologize for my drawing, but if we think about front leg versus back leg, the front posture of the metacarpal bones normally would have a fairly straight relationship. And if we start to see this angle increasing, there's a tendency to straighten out the knees and make the legs more straighter, which we're not going to get complete clearance of the urinary bladder. And so that percentage, say it's 25% of turbid urine, is just enough to keep that UTI going. And so that's in terms of how this relationship works. The question always is, well, how does the lungs affect that? Well, if we look at chronic, usually means there's some circuit in the body that's not working quite right. And so when we run the IHT analysis, we find out, well, this time it's lung, so we need to support that. So supporting the lower urinary tract with postural nail trims, we come in and make sure that the nail is rounded. So a rounded nail, we make sure we're not touching the point. If we touch the point here, we increase the angle of the front foot and straighten the leg so we don't get complete clearance of the bladder. And so that's the mechanical side of it. We want to balance the lung with the hemp oil infusion. We also want to add nutritional support with wheat germ oil, which is very specific for the lung. And then we can manage the UTI symptomatically if we need to use antibiotics or we can also take a urine sample to keep track of the urine environment during this process. So all treatment planning takes about 3 months, but at the same time, our goal is to clear this chronic UTI through the lungs. And so the question was, do we need to worry about the lungs? Should we take an x-ray or should we do an ultrasound? And the answer is no. At this point, we can be supportive, but at the same time, we want to make sure in 3 months that we're actually clearing that process. So if you have questions, obviously call us 847-541-4005. You can go to our Grove email, thegrovepets@yahoo.com, or give us a call either way, and we'll answer your questions. But we're going to get all of this ready for you. You may have the oil already, but I'd like to start the wheat germ. We can use a standard process product, or we can even consider buying wheat germ over the counter. So give us a call on which route you'd like us to go with that. And certainly if there's questions, give me a call. Thank you.